Welcome back, everyone. I've got a very hard act to follow. William did an amazing job for the first 4 hours. That was brilliant. So thank you so much, William. And I welcome people who are joining us for the first time, but those of you also that have stayed with us for the 4 hours to date. And I hope you enjoyed the second half of the symposium as much as the first. I personally found it absolutely riveting. It was really so interesting and engaging. So for the next session, we have a panel discussion titled More Than Words on Paper, the Reality of Protection Orders for Service Providers in Papua New Guinea, Solomon Islands and Timor Leste. This session will run for an hour and will be chaired by Ms. Tracey Newbury. I know Tracey, and she is a Senior Program Manager at the International Women's Development Agency. I will now hand over to Tracey, who will introduce the session and the panel members. Over to you, Tracey.
Thanks, Judy. Hi, everyone. As Judy said, I'm a Senior Program Manager with the International Women's Development Agency, managing a number of our programs working on domestic violence across the Pacific. IWDA's model is that we work with and through our partner organisations. I'm really not sure how this panel session is going to go. Many of our speakers are having trouble either connecting to the internet, have had various illnesses and other troubles. So we will have a variety of presentations in different forms. So bear with us as we go. Our first presentation will be a an audio presentation by Ms. Luania Kirori, who is a founding member of the Eastern Highlands Family Voice in Papua New Guinea. Ms. Kirori has maintained her passion for human rights and empowerment for over 20 years, working in the government and community sectors, including volunteering with the Young Women's Christian Association and as the Chief Commissioner for Girl Guides. In 2013, she obtained a diploma in guidance and counselling from the University of Goroka. She has shown leadership, dedication, and ability to find solutions and build strategic relationships. Ms. Kirori is particularly passionate about building the confidence of young girls and women in Goroka.
His vision to promote happy, healthy, harmonious, and wealthy families in Eastern Highlands province and beyond. Mission is to work towards zero tolerance to gender-based violence, child abuse, gender inequality, and to promote family values, gender equality, child rights, and to alleviate poverty in our society. Eastern Highlands Family Voice takes a multi-pronged approach to ending violence within and outside of the family. It employs staff working with children, men, and women through dedicated programs and face-to-face counseling. It uses 4 key methods: counseling and referrals, teaching and training, awareness and advocacy, and organizational development and capacity building. The purpose of this paper is to discuss and reflect upon counseling referrals in relation to child protection and interim protection order. Counseling services: Family Voice responds to client survivors' needs with holistic and supportive services. It goes beyond counseling with empowerment programs through focus group discussion, identify survivors with similar problems and engage them through vocational skills to empower them to be economically independent. We do follow-up and home visits for monitoring and evaluation purposes, accurate storing to data management and reporting. There are key programs that Family Voice does. The key priorities are providing counseling to survivors of GBV and advocate to create happy, healthy, harmonious homes, life skills and vocational skills training to empower economically handicapped mothers, create referral pathway and liaise with relevant partners for clients' referral purposes. Data management is accurate and up to date. Clients follow-up are efficiently coordinated and carried out. Monitoring and evaluation are done quarterly to measure the impact of counseling reports and collated accordingly. Child protection is about ending child abuse. Child protection is everyone's business to protect the child. It is often argued that governments should focus their attention, resources, and legal protection on the most extreme forms of violence against children, what most people understand to be child abuse. This is problematic. Let's see a few reasons. The Convention on the Rights of the Child protects children from all forms of violence, and the Committee on the Rights of the Child has made it clear that states must have a national strategy and legal policy framework for ending violence against children. Like other human rights treaties, it establishes the right to life, provides absolute protection in human or degrading treatment or punishment, and it protects child from armed conflict, sexual and economic exploitation. A human rights approach acknowledges the impact of poverty, lack of education, and limited health care on children's exposure to violence, and the opportunity they have to escape it. State must have strategies to prevent and respond to all of these rights violations, but this must sit within an overall national plan for rejecting and seeking to end violence against children, consistent with the child's civil rights, the unique role of the family. The most common categories of abuse are physical, sexual, emotional, and neglect. Human rights approach to child protection has three overriding concerns: to promote and protect the child's human dignity, physical integrity, and self-respect. Child protection in Papua New Guinea. In our overly populated identity crisis era, it is easy to forget or ignore these greatest needs. The child protection system in Papua New Guinea suffers from limited and human resource capacity, weak governance and coordination mechanism, inadequate access to both preventive and responsive services, as well as lack of reliable data. The challenges. Violence includes physical, sexual, emotional, as well as neglect. These are realities for most children in Papua New Guinea. Children are unsafe in their very homes and communities and can be devastation with short and long-term repercussions on child's health and well-being. Cognitive development. The impairs children's cognitive development and perceptions irregularities. The advent of new technologies, particularly mobile phones, internet access, are also bringing opportunities and risks. Solution: improve legal policy frameworks for the protection of child, provide strong foundation for a national child protection. Look out in Pikinini Act 2009. The key pieces of legislation: Working Together to Safeguard Children 2018, the UN Child Rights 1992. Section 47 inquiry means that CSC must carry out an investigation when they have reasonable cause of suspect that a child who lives or is found in the area suffering or is likely to suffer significant harm. The aim is to decide whether only action should be taken to safeguard the child. Prevention. Networking partners like NGOs and government agencies address the underlying causes of violence through the implementation of positive disciplining and other teachings. Responses. Counseling services for survivors, GBV, and family and sexual violence abuse and perpetrators. Case management. Referrals to networking partners. Interim protection order is issued by mandated office, police, courts, and PABSOL, and the Community Development Office. Police assists survivor to prepare survivor's application. A notice of 2 weeks, 14 days is served. The arresting police officer takes complainant to the court. The arresting police officer enforced the law. After receiving interim protection order, the survivor can ask for protection order for longer term support. If any time before the given times, 2 weeks, and the perpetrator breached the law, the survivor must report to the arresting officer. Additional charges will be laid against the perpetrator. Protection order is issued by the courts only. Protection order can last for up to 2 years. It can be extended upon the survivor's request if the violence continues. Perpetrator breached the law. Challenges. Court adjournments in the event survivors give up. Arresting officers do not follow up or check complainants. Perpetrator continue the violent behavior. Eastern Highlands Family Voice. The referral process. One option is referral to a more appropriate or different skilled individual or organization, the government bodies and the stakeholders. Eastern Highlands, as there is currently a lack of coordinated government response and a lack of resources within the province to address gender-based violence, the relationships that Eastern Highlands Family Voice has with partners is essential, and the provision of healing and protective services. Eastern Highlands Family Voice uses its partners to respond to clients' needs with a holistic and supportive services. The word of mouth appears to be the most effective way of spreading information about the service. We have attached the service pathway flowchart. Thank you.
Our next speaker, I'm very pleased to introduce Mana Olinda Cardoso, who's the Program Manager for ALFeLa, which is the legal aid organization for women and children in Timor-Leste. Mana is responsible for organizational development, donor relations and compliance, and monitoring and evaluation. She works closely with lawyers and legal officers at ALFeLa and is deeply engaged with the sector and stakeholders working on the rights of women and children relating to the justice system in Timor-Leste. Thank you, Mana.
Okay. Hello, everyone. So as the team introduced to you, my name is Olinda Cardoso. We are just finished celebrating the 16 days campaigns to eliminate ending violence against women in our organization, especially in our village. So it's there is a media came to take our video. We have an illustration and positive message to gain our community on prevention violence against women in our community, especially in area of ALFeLa office in Dili. So let me start my presentation. I am representing my organization. This is the illustration about our work. First, I would like to presenting about ALFeLa, so that our ALFeLa is women and children legal aid. We call with our language is Asisténsia Legál Feto Labarik in Timor, or legal aid for women and children in our country. We are independent, impartial, non-profit legal aid organization. We are leading by Timorese. We base only in Dili, only in Timor-Leste. We cover 12 municipalities, including Ukusi region. We have office in Baucau, Suai, Ukusi region, and the central is the national office is in Dili. Next slide, please. So our vision is a formal justice system that fair without discrimination to women and children. And our mission is to support women and children in Timor-Leste access to formal justice system. Our main program, we have 3 main programs: legal assistance for women and children, legal education for community, for PNTL or our police, and professional worker, those who provide service for victim of gender-based violence. We also conducting very active advocacy to formal justice system as like a judicial member, to parliament and then to government regarding with prevention and responding to gender-based violence cases in Timor-Leste. We have experience about very good advocacy in international level. So today I will just focus ALFeLa working on provide legal assistance for women and children in Timor-Leste. ALFeLa provide high quality legal assistance to women and children to access to formal justice. We prioritize legal assistance for victims of gender-based violence and domestic violence in all municipalities in Timor. We also provide additional assistance such as transportation, food, accommodation, and some basic needs that victims of gender-based violence need to access to formal justice system. As like, you know that in our country is very pure and as the road is very bad. To travel to one municipality to other municipality, there is a cost. So we need to have a budget for support victim access to transportation, to travel for access to formal justice system. We also provide legal aid to suspect, especially for women, those conduct violence to her husband and do the self-defense because of domestic violence happen again to herself. So we practice in the court for provide legal assistance for women that become suspect because of self-defense in their life, in her life. Next slide, please. So this is the ALFeLa client cases. To let you know that that number 636 cases is only registered in ALFeLa for this year, from January 2021 until November 2021. So we have new client cases 636, and we have active cases about 2,184. From this year, we also close the cases that already gets sentenced from the court, about 219 cases. So this is the phase that loop in our online database. So when we updated all the cases in our ALFeLa online database, it will be came like this. We have statistic data, then we can produce when partners request about the data, we can just produce and then provide the data to our client. Only the number, the specific information, is confidentiality for us. ALFeLa online database. So in our database, we can produce and we can see that the type of cases that we register in ALFeLa system, and also the sex or the gender that we have, and clients age that we need to produce the report. So in here, you can see that we have the cases that register in ALFeLa is gender-based violence. So most of the cases is about domestic violence, and following by sexual violence and other criminal cases like physical violence and civil cases. Most of the cases that we provide, most of the cases that register in ALFeLa with sex by male, that's mean that children, the client is children. we are not provide legal aid for adult male. We only provide legal aid to children that are sexed by male. So we have 2% male cases and 98% that our client is woman. We also have clients that under 18. So we have 20% client that still young, still under 17 years old. Next slide, please. So this is the type of cases that register in ALFeLa for this year. We have about 636. From that number, domestic violence is about 373 cases, which is the type that shown in the slide. Domestic violence linking to physical violence that happen in the family, and we also have 8 cases that very serious offenses, physical, that happen to women in Timor Leste. There is 29 cases that violence happen to women. That's include four type of cases. One is physical violence, economic violence, and psychology violence that happen in that woman, and also controlling that woman cannot go to visit her family because of they already provide things to woman family. So we have 29 cases in this year. There is also women's did violence to her kids. It's a register in ALFeLa office 11 cases, and sexual violence happen in the family levels 14 cases. That's only for adult women, and incest, or we call it abuse of vulnerability. The suspect is fathers, and three is father, and then 2 is grandfather. So we have 5 cases in this year, and also have homicide or murder that the husband did to his wife. We have 2 cases that our legal officer and lawyers helping women access to justice. Next slide, please. So this number is only for sexual violence and sexual abuse, that not including domestic violence in these cases. So we have 5 cases about human trafficking. It's happening in border in our country. 2 cases happen in Maliana, that's border with Indonesia, and 2 cases happen in Dili because of that suspect is a member of government, and also 1 case is in Suai Kobalima. It's also border from Timor-Leste and Indonesia. We have very aggravated rape, sexual violence happen. 93 cases happen in women in Timor-Leste, and sexual abuse of minor and aggravated, very sexual, very sensitive cases. 46 cases that our young and child face very problems in Timor is sexual abuse for minority. The total of cases sexual violence and sexual abuse is 140 44 cases. And then the last thing is about civil cases. We also provide legal aid for civil cases, but only linked specific for gender-based violence issue, especially like alimentation or parental authority that's asking for food, visited guardianship, and money that need to cover kids or children school. And we helping women to would like to divorce with their partners, and also paternity recognition and regulation of parental authority. So for this year, we have 25 cases about civil cases. So the number of total cases that we have, like I mentioned, that 636 cases for this year that our legal officer and our lawyers provide legal assistance to women and children access to formal justice. We are not working by only by ourselves, but we are working together with our partners, our key partners. So ALFeLa only provide legal aid for women and children and some additional basic need that clients need. But our partners, those who provide shelter house, safe, and also medical designations, it's did by our key partners. And also our police or PNTL, they are very active in the referral cases to ALFeLa. So in here, ALFeLa working to strengthen network and partnership, especially with judicial actors in order to protect the rights of women and children. In the court, there is a limited staff to helping women access to formal justice system. We have about 29 client cases that have disability, especially with client that cannot talk. So which is mean that if the cases bring to formal justice, the court need to asking organization that can provide body language, speak or sign language. So usually ALFeLa is the one judge and prosecution asking for help to contact the organization. So because we have very good relationship with our civil society organization, we can pay for that because our donors have budget to support it. But for now, the government didn't have budget to cover about inclusion, especially for sign language. So during the years, ALFeLa improved the referral mechanism to be more effective and efficient. As you know, the pandemic is global issue that all the country face. We increased the referral mechanism by creating the WhatsApp group to make sure that our client is secure and safe. In this year, we have a very damaged flooding happened in April. So the referral network need to working extra to make sure that our client that already victim not be victim again because of flooding situation and then economic impact to their life. So the referral network need to work very serious because of clients can be have violence against, especially for those who stay in the refugee camp. There will be sexual violence happen in there. So we need to make sure that it's only one place happen and other place we have to prevent. We also collaborate with partners in order to respond the needs of rural women and children. So those most of our clients that not stay in the shelter or safe house, they are stay in their home town. But as you know, we only have 4 courts that present in Timor. one court cover 4 municipality. To travel from one municipality to other municipality, it will be cost. And our road is very bad. So we need to very active contacting with our client that stay in their home. So the referral network need to get their function to always contacting the client that about hearing and trial schedule that will be judicial actor will be contact ALFeLa and then referral network that working provide service to victim of gender-based violence. So in here, yes, please. The last thing about the strategy, we refer cases to each other. Most of our ALFeLa cases is we receive from police, or we call it a vulnerable police unit. So all the cases that we receive, 80% is came from vulnerable police unit. So because the community only know that when cases happen, they will go to the police. And the second one is from PRADET, those organizations that provide medical examination to women that face violence. Because of pandemic, we have the strategy to establish the pilot project about paralegal. So all the paralegal, we have about 10 paralegal presenting in each municipality in Timor. So they help us to dealing with client and then contacting with client, so they make sure that client will be participate in the hearing process and then trial process. The prosecution and then court are very depending to ALFeLa, because we are the one that have actively contacting client to provide legal information to our clients. So the last thing is about risks that and challenge that we face in this year. COVID-19 pandemic and state emergency caused delay to the program implementation, especially for legal aid, because of the movements need criteria about authorization from the government to travel from each municipality to another municipality. So we need to process the letter asking for authorization, so ALFeLa can pick up the client to attending the court process. This is the situation that very limited authorization to civil society organization. But because we have good relationship with police, they always allow us to travel if the issue about legal assistance for victim of gender-based violence. So we have a very high number this year. If we compare with the last year, we only have about 500 cases, but this year till November we have about 636 client cases, and then December this month we register about 14 cases. So it's meaning that the number is high, but the limitation of judicial actor to responding to the cases is very slow because of human resource in the judicial actor in the court level, prosecution and public defender is very low number. So and then plus the pending cases from previous year, it will be very high number still pending. So it will be impact to our client that will be take back the cases to not process to the legal justice system process. So we need to do the advocacy for government to do the required recruitment process for judicial actors. And this year is the priority for our government to make a recruitment for judicial actor. So, and also the cases is increased, but we only have 8 legal officers and 4 lawyers to responding to GBV cases. So even we receive complaint from our referral network because we responding very late, but our limited staff to respond to these cases is very slowly because we only have 12 staff for legal issue. 12 staff is 4 is lawyers and 8 legal officer. That's why we do strategy to respond to this challenge. We did the recruitment for paralegal, so they can stay in each municipality to helping victim of gender-based violence access to formal justice system. So that's the work that ALFeLa did for this year, and we also focus for advocacy for incest cases that we submitted to government and parliaments, still in the discussion in parliament level, to provide specific article for incest cases, because if the cases happen to children, there is an article specification for incest cases. But if these cases happen to adult people, there is an article to protect women is very very high, very low to punish the suspect because of the sex happened because of women want to have a sex. But this is the issue that our legal officer and our lawyers still do the advocacy to government and parliament to have the new article for incest cases, especially for adult women.
Mana,
Thank you.
we need to move on to our next panelist. Have you got one last message for us?
Sorry?
We need to move on to our next panelist, but do you have one last message that you'd like to say?
I'm finished already.
Okay, thank you so much for that. I'm really pleased now to introduce Kiungui-Kepa who's the legal advisor with Voice for Change in Jawaka province in Papua New Guinea. She completed her law degree at the University of Papua New Guinea, and her role involves providing legal advice and assisting to prepare legal documents for women and girls who seek support from Voice for Change, including helping with interim protection orders and family protection orders. We're really pleased that she can join us today. Thank you.
I work with Voice for Change as their legal person. I am attached under the EVA response desk under Voice for Change, especially for the EVA response desk. We have 3 offices. Jawaka province is one of them, newly established province of Papua New Guinea. So we have 3 districts, which is North Wagi, the South Wagi, and the Jimmy. We have established an office in North Wagi already, and currently 2 of our offices are located within South Wagi. So for our legal aid program, it started this year. This December would be the first year in full operation in both of our offices. So prior to having legal persons working with Voice for Change, before that we had project officers who assisted client mothers, survivors who came in for IPOs, interim protection orders, and family protection orders. So, but the numbers weren't increasing. It was just for those women that knew that there was legal help that they came. But I think this year there was a bit of a slight increase in women coming because they know that there's legal representation available at Voice for Change office. So from this year, for our first, second, and quarter report, we did a total of 43 IPOs. 17 of them were family protection orders. And out of these 43 IPOs, 14 of them were successful. We are located rurally, hence most of these women have no access to telephones, or so we cannot get updates from how they're going on with their IPOs and protection orders. So that is one of the challenges of working with rural women, especially. So one of the other challenges is the court system itself. In Juaka, we only have one district courthouse, which is Minch, and it is located in South Wagi. So we only have that courthouse servicing the whole population of Juaka. So for women in other districts to travel to the nearest courthouse to access its services is a bit of a challenge. It's a hassle, really. Most of these women are rural women. They cannot afford the transportation costs, and that is one of the main challenges, really, because going back and forth the courthouse, the court justice system up there is a bit of it's frustrating, really, because most of this sitting magistrate and magistrates that will be preside over these IPOs and protection orders are not there most of the time. That's why most of these IPOs and protection orders are being adjourned to a later date. And this is one of the roadblocks for rural women because they cannot travel back and forth to and from the courthouse. 10% of them are rural women with no proper form of education background. When we get the data and we see from the information we get from them, when we want to do the statements, we see that most of them have gotten as far as grade 3, grade 4, grade 5. So most of these women are intimidated when they go up and they see the courthouse clerks not being helpful towards them. So I think one of the main challenges of our office, we have a problem with the justice system because it is not being accessible to rural women. So I think protection orders, when client mothers, survivors, they come to the office, we have our program officers who attend to them, and if they see that they need legal advice or if they need to take legal steps or whatever, if they see that they need to be referred to the legal aid team, they do internal referral along with their file. So we see from their statements, we can see if they need IPOs or protection orders or child maintenance and other civil cases, stuff like that. So from the statements we get, if we see that the survivor is in immediate danger, we also have a safe house where in situations where women from other provinces getting married to males from Juaka province and who have been abused, we tend to keep them in our attend to them to collect statements and medical records, and then we proceed with preparing the IPOs and protection orders. If we see the situation is been continuously been abusive for quite a while, we apply for the protection order. The Protection Act of 2013 PNG, it provides for the interim protection order itself it lasts for only 30 days unless it can be renewed, replaced by a protection order. Protection order, if the period is specified, it it extends for a 2-year period, or the period is not specified, the order remains in for 6 months. So most of these women come in, we apply for protection order, so it can last for a longer duration of time. So I think most of the struggles that we're facing with these rural women is that when they come to our office, since our office is located in the community, and when people see that when women come to our office, news gets out, and then they tell the woman, oh, you don't have to go and seek legal help or whatnot, because you will jeopardize your family ties and your family relationships and stuff like that. And they're being placed under extreme duress, and they cannot come back to the office. For women who are headstrong on accessing justice and seeking legal help, they do come and then they update us. So we try to advise them that this is not to break up your marriage or your relationship or anything, because most of these women are illiterate and they do not understand how the protection order works. So we have to explain it to them. Likewise, their husbands or whoever is accompanying them to the office, we try to explain it to them that protection orders are nothing that will someone when they're being served a protection order hearing, they tend to tell the community court, and I have to divorce her or stuff like that. Most of our women, they're coming in, but they're reluctant because of how the notice of hearing is, from the reactions they're getting in their community and in their home, it's not very, supportive and stuff like that. That's why the reality itself for rural women to seek protection orders, whether it be an IPO or an FPO, and it's very hard, and it's frustrating really, because when we want to do an IPO for the perpetrator, we're not doing it against the perpetrator himself. Challenging his family, the whole relatives and whatnot. And for Papua New Guinea, the Islands itself, it's a bit of a hassle really, because we are going up against the whole houseman, the whole relatives of this one. And if the man or if the perpetrator is professional, or if he's an employed person, then the whole community rallies up against him, and they tell the woman, what are you trying to do? He's the only one that is working and supporting all of us, and you cannot challenge him or take him to court and stuff like that. So we have all these challenges, especially for rural women, for rural survivors especially. So I think from our office here in South Wagi, it's for the women here, they are accessing the courthouse, because Minch courthouse is located within vicinity, but it's a bit of a struggle for the women that are living inside the villages and some of the remote parts, where they have to take buses to the main road and then transit at marketplaces before they travel up to the main courthouse. So in the North Wagi, where our office, we have another office there. Every Wednesday, I am the legal person. I travel up there every Wednesday, and I attend to so for North Wagi women, we do IPOs and we do protection orders but for them to travel back to Minch District Court and file, it's a bit, we're not getting any updates from these women, because most of them, they're saying that they cannot afford the bus fare back and forth from the courthouse. Because once they get there, the court clerks, they advise them that the magistrate isn't in yet, or the sitting magistrate hasn't arrived, or it has traveled out to Port Moresby or some other provinces, so you have to come on this date. So when they do return on that date, most likely the same ordeal happens. So that's why it discourages women from going to the courthouse, especially. So I think for Family Protection Act and the Interim Protection Order, most of the time, some of the clients that are referred to us are from the police station up at Minji themselves, because they don't have printers and laptops to do the IPO or collect statements. So when they see mothers going up to the police station, they refer them back to our office, and they say, you go there and voice for change people, they will assist you with IPO. So we do get referrals from the police station. And then when an all IPO is breached, or when we have an FPO being breached, and we refer them to the police station, the police, they don't have enough manpower to do arrest, so they don't have vehicles. So the breaching of IPOs and protection orders are not taken seriously, because most of these perpetrators are inside and they're located in rural areas. So once they've breached the IPO, they're on the run, and police officers they cannot locate them because they're at their own turf and stuff like that. So we've have all these challenges. That's for when we're trying to get help from the police and stuff like that. We're experiencing setbacks and we're experiencing problems as well. But I think for way forward, I think more awareness should be done on laws and the legislation, especially in family law in Papua New Guinea, because it's very messy. It's such a gray area, lots of gray area. Because if you want to take a husband or a father or a man to court, you're not taking only the perpetrator, you're challenging his whole community, his whole family, his whole tribesmen, and that's what really discourages women from.
Ms. Kalipi, could I interrupt there, because your presentation has been fantastic, but we are struggling a bit to hear at times. Very heartfelt, and I know you've had many challenges. Tracey, I'm not trying to take over here, but there was a question asked of Olinda earlier on by Fiona Gunn. I think we won't have time to ask it in the session. So I wonder if Olinda, you would mind in the chat answering the question from Fiona, which was about your very impressive data system. And Ms. Kalipi, if you could see that there's a question for you about the burden of proof when in applying for a protection order in Papua New Guinea. If you wouldn't mind answering that in the chat. Sorry about the interruption, and thank you very much for the presentation so far. Back to you, Tracey.
All right. Thanks, everyone. I want to thank our wonderful panelists who were able to join us today. Mana Olinda, Miss Luana, who you just heard on the audio, and Kiungui. We also were trying to connect with our other partners, the Nazareth Centre in Bougainville and the Family Support Centre in Solomon Islands, and we will aim to include their inputs in the written report from this symposium. Because the message from our partners is that interim protection orders are really challenging for women in the community. Sometimes it's the reluctance of the courts and the magistrates to action and take on their roles and responsibilities under the various laws. And sometimes it's the reluctance of the police to actually enforce the IPOs, causing sometimes even greater harm and distress to the survivors of violence. If there are any questions that we haven't been able to answer during this session, we'd be really happy to take them on notice and respond to everyone later. So thank you very much to ANU for organising it, as I said, to our wonderful panellists and to all the participants.
Thank you, Tracey. I know a lot of work's gone into preparing your from your panelists to prepare for your session today. So I am sorry some of them couldn't join us, but yes, as Tracey said, we will seek to include their presentations and what they have prepared when we compile a report on the symposium. In particular, I'd like to thank Ms. Cardoso, Ms. Kalipi and Ms. Kirori. I think they underlined, if nothing else, how challenging the work is, but also how courageous the workers are who work at the front line to address violence against women and girls. It's quite amazing that they manage to do the work that they do.